Dr. Colonel Arun Kumar. I'm a gastroenterologist and I started my career in Indian Army, which I prematurely left in 1998, and since then I'm working with this hospital, Pushpavati Singhania Hospital for Liver and Gastroenterology. I deal with patients related to abdominal problems. To be more specific, the problems like gas, problems related to food pipe, stomach, intestine, liver, and once again gas, which is so commonly stated by patients. Constipation, stool problems, jaundice. So all these patients we treat at Pushpavati Singhania Hospital. The advancement in this specialty has been the ability to diagnose and treat these patients. And besides, CT scan, ultrasound, MRI, one of the most important tool is endoscopy. Now, endoscopy means you can look inside without cutting open. And we can now look inside the food pipe, stomach, intestine, from above and below. So this is very helpful in diagnosis of various kind of diseases. Not only we can diagnose, but through the endoscope, we can treat also. Like if there is a bleeding, we can give injection, we can apply laser. So without surgery, we can treat these patients. If there is a tumor, we can remove the tumor. Or, if there is some obstruction somewhere, we can dilate. Without surgery, we can treat that. Besides that, we all know that stones in gallbladder are very common, and these stones can produce, jaundice. And these stones now can be removed through the help of endoscope. We call it as ERCP. So the endoscopy that can be done in variety of diseases, and which is being done in this hospital, and we are doing it regularly. Besides that, all those diseases, common diseases related to liver, like hepatitis, cirrhosis, cancer, infections, abscesses, and diseases which are related to pancreas, a structure which produces juices which digest our food, are also being treated here. This hospital has advanced laboratory facilities. It has blood transfusion department. It has a highly well-equipped intensive care unit, and has all the supportive specialties which are required to practice gastroenterology. Let me now just discuss some of the common problems which people face, or people they think that they are having it. And in this regard, one of the things which most Indians complain and feel that they have is gas. Now, I would like to tell you that every human being has gas up to 1.5 liters. So it is not abnormal to have gas. It's a normal phenomena. But somehow we Indians are very much obsessed with the idea of gas. But there are situations where you can have, more gas formation, or you may have more sensation for gas. And the symptoms for this, gas, so-called gas, is that you may pass from above. We call it belching. You can have, few belches in the whole day are normal. They are not abnormal. Or sometimes you can pass more gas, from below. That is a flatus. That also can be normal. Or you may have your tummy being bloated. That can be another symptom. But if these symptoms become, they increase or they become too much, then definitely patient is going to feel it. And let me tell you, there are few important things which may be responsible for this feeling of excessive gas. One of the thing is like smoking. You take a lot of air in, that is felt as a gas. If you are not chewing your food properly, or if you are talking, or if you are laughing too much, you will find that the gas sensation will be more, because essentially most of the part of the gas comes from air. It is the air which we swallow. Everything does not go into lungs, some goes into stomach. That is responsible. But there are certain food items, like rajma, chana, like cabbage, patta gobi, even other gobi also. All these things can produce excessive gas. And you may also feel more gas production if suppose food is not absorbed in small intestine and the food goes down into the large intestine where bacteria will act on them and produce more amount of gas. Or if there is an obstruction to the flow of contents in intestine, any part of the intestine, then you may have the sensation of gas. Another issue which I like to say is alcohol. Now, this disease is spreading very fast in our community, and alcohol is one agent which can involve the whole body. So, don't think that it is only liver, but it can involve every aspect of life, the whole body. But the two diseases in my specialty which are more likely, one is liver disease and the second thing is pancreatic disease. Of course, we have no clear idea who will develop alcoholic liver disease or not, but whatever is known till now is that if you are drinking regularly, or if the amount of drink is large, and if the quality of alcohol or the percentage of alcohol, all those things have a lot of bearing on developing liver disease. Besides that, I would also like to mention that some people think that drinking beer is not taking alcohol. I should remind them that one small peg of whiskey is equivalent to 330 ml of beer and 110 ml of wine. So beer is also as much of alcohol as whiskey, rum and other things are concerned. So alcohol is alcohol, whichever shape you take. Then if you are taking alcohol regularly, you must undergo regular checkups also. Don't wake up when you developed established disease, or when you developed a chronic liver disease, or when you developed an advanced liver disease, where nothing can be done. Another very common problem in in society is constipation. Constipation is a very, very common disease, and particularly in children. And I think what is contributing to constipation in children is that the parents are not aware. Second, children have to get up early in the morning. They have to go to the school. There is no time to go and pass stool or spend time in toilet. And they come back in the afternoon and try and pass. So this habit normally forms in the childhood, that how many times we are passing motion. And we are not careful. What happens is that later in life, this becomes a big problem. So I feel that the parents should pay enough attention in childhood about the passage of stool. Because once the habits are formed, then later on it becomes very difficult. Then acidity is also a very, very common disease, and I think almost 40% of population suffers at least at some time this term called acidity, for which there is very effective treatment, and one should get himself checked and be treated. Anything more?